All right. Hello, everybody. So I found out what happened. Okay. Well, I'm just going to go ahead. This is going to be a take two. This is going to have the information so you guys can know exactly what that live that I just did was about. So let me turn this down a bit and we can go ahead and get started. All right. Here we go. Thank you for coming back in. I appreciate that. Here we go.
What is monkeypox? Monkeypox is a rare disease caused by the monkeypox virus. It leads to rash and flu-like symptoms. Like the better-known virus that causes smallpox, it is a member of the family called orthopoxvirus. Monkeypox was discovered in 1958 when two outbreaks of a pox-like disease occurred in groups of monkeys being used for research. It spread mainly through human contact with infected rodents, but can sometimes be spread through skin-to-skin contact with an infected person. There are two known types, clades, of monkeypox virus, one that originated in Central Africa and one that originated in West Africa. The current world outbreak, 2022, is caused by the less severe West African clade. Transmission, animal to human, zoonotic. Transmission can occur from direct contact with the blood, bodily fluids, or cutaneous or mucosal lesions of infected animals. In Africa, evidence of monkeypox virus infection has been found in many animals including rope squirrels, tree squirrels, Gambian pouched rats, dormice, different species of monkeys and others. The natural reservoir of monkeypox has not yet been identified, though rodents are the most likely. Eating inadequately cooked meat and other animal products of infected animals is a possible risk factor. People living in or near forested areas may have indirect or low-level exposure to infected animals. Human-to-human transmission can result from close contact with respiratory secretions, skin lesions of an infected person or recently contaminated objects. Transmission via droplet respiratory particles usually requires prolonged face-to-face contact, which puts health workers, household members and other close contacts of active cases at greater risk. However, the longest documented chain of transmission in a community has risen in recent years from 6 to 9 successive person-to-person infections. This may reflect declining immunity in all communities due to cessation of smallpox vaccination. Transmission can also occur via the placenta from mother to fetus, which can lead to congenital monkeypox or during close contact during and after birth. While close physical contact is a well-known risk factor for transmission, it is unclear at this time if monkeypox can be transmitted specifically through sexual transmission routes. Studies are needed to better understand this risk. How common is monkeypox? Monkeypox is rare, but the number of cases is increasing in Africa, as well as in regions that haven't seen these infections before. Where else is monkeypox found? For decades, monkeypox was mostly been seen in Africa. However, it's occasionally found in other countries, including the United States. In the spring of 2003, the first outbreak of monkeypox outside of Africa occurred in the United States. A shipment of infected animals from Ghana was imported into Texas. The infected rodents spread the virus to pet prairie dogs, which then infected 47 people in the Midwest. As international travel becomes more common, viruses that were once fairly confined to certain locations can more easily spread around the world. In the summer of 2021, a case of monkeypox was found in a U.S. resident who had traveled from Nigeria to the United States. Then, 2022 brought outbreaks to regions outside of Africa, including Europe, the Americas and Australia. Who does monkeypox affect? Anyone can get monkeypox. In Africa, most cases are among children under 15 years old. Outside of Africa, the disease appears to be more common in men who have sex with men, but there are numerous cases in people who don't fall into that category. What are the signs and symptoms of monkeypox? After exposure, it may be several days to a few weeks before you develop symptoms. Early signs of monkeypox include flu-like symptoms like fever, chills, headache, muscle aches, fatigue, swollen lymph nodes. After a few days, a rash often develops. The rash starts as flat, red bumps, which can be painful. Those bumps turn into blisters, which fill with pus. Eventually, the blisters crust over and fall off. The whole process can last 2 to 4 weeks. You can also get sores in your mouth, vagina or anus. Not everyone with monkeypox develops all of the symptoms. In fact, in the current 2022 outbreak, many cases aren't following the usual pattern of symptoms. This atypical presentation includes only a few lesions, no swollen lymph nodes, less fever and other signs of illness. You can have it and not know it. But even if you don't show many signs of infection, you can still spread it to others through prolonged close contact. Monkeypox is a rare disease caused by the
Hold on one
monkeypox
moment.
virus. Monkeypox.
Sorry, guys. Okay, let me conclude it.
Monkeypox can cause a rash which may look like pimples or blisters, sometimes with a flu-like illness. Monkeypox can spread to anyone through close, personal, often skin-to-skin contact including direct contact with monkeypox rash, scabs, or body fluids from a person with monkeypox. Touching objects, fabrics, clothing, bedding, or towels, and surfaces that have been used by someone with monkeypox. Contact with respiratory secretions. Illustration of couple snuggling in bed. This contact can happen during intimate contact including oral, anal, and vaginal sex or touching the genitals, penis, testicles, labia, and vagina or anus, butthole, of a person with monkeypox. Hugging, massage, and kissing. Prolonged face-to-face contact. Touching fabrics and objects during sex that were used by a person with monkeypox and that have not been disinfected, such as bedding, towels, and sex toys. Having multiple or anonymous sex partners may increase your chances for exposure to monkeypox. Limiting your number of sex partners may reduce the possibility of exposure. We are trying to better understand if virus could be present in semen, vaginal fluids, or other body fluids. How is monkeypox diagnosed? Because monkeypox is rare, your healthcare provider may first suspect other rash illnesses, such as measles or chickenpox. But swollen lymph nodes usually distinguish monkeypox from other poxes. To diagnose monkeypox, your healthcare provider takes a tissue sample from an open sore, lay-in. Then they send it to a lab for polymerase chain reaction PCR testing, genetic fingerprinting. You may also need to give a blood sample to check for the monkeypox virus or antibodies your immune system makes to it. Is monkeypox curable? Monkeypox is usually a self-limited disease with symptoms lasting from 2 to 4 weeks. Most people with monkeypox get better on their own without treatment. Following diagnosis, your healthcare provider will monitor your condition and try to relieve your symptoms, prevent dehydration and give you antibiotics to treat secondary bacterial infections if they develop. There's currently not an approved antiviral treatment for monkeypox. Antiviral drugs may help, but they haven't been studied as a treatment for monkeypox. Several investigational antivirals with activity against monkeypox are available, but only as part of a research study. How do you prevent monkeypox virus? A smallpox vaccine provides protection against monkeypox, but its use is currently limited to clinical trials. Prevention depends on decreasing human contact with infected animals and limiting person-to-person spread. The best way to help prevent spread the monkeypox virus is to take the following steps to prevent getting monkeypox. Avoid close, skin-to-skin contact with people who have a rash that looks like monkeypox. Do not touch the rash or scabs of a person with monkeypox. Do not kiss, hug, cuddle or have sex with someone with monkeypox. Do not share eating utensils or cups with a person with monkeypox. Do not handle or touch the bedding, towels, or clothing of a person with monkeypox. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. In Central and West Africa, avoid contact with animals that can spread monkeypox virus, usually rodents and primates. Also, avoid sick or dead animals, as well as bedding or other materials they have touched. If you are sick with monkeypox, isolate at home if you have an active rash or other symptoms. Stay in a separate room or area away from people or pets you live with, when possible. Avoid contact with infected animals, especially sick or dead animals. Avoid contact with bedding and other materials contaminated with the virus. Thoroughly cook all foods that contain animal meat or parts. Wash your hands frequently with soap and water. Avoid contact with people who may be infected with the virus. Practice safe sex, including the use of condoms and dental dams. Wear a mask that covers your mouth and nose when around others. Clean and disinfect frequently touched surfaces. Use personal protective equipment (PPE) when caring for people infected with the virus. Vaccination. CDC recommends vaccination for people who have been exposed to monkeypox and people who are at higher risk of being exposed to monkeypox, including people who have been identified by public health officials as a contact of someone with monkeypox, people who may have been exposed to monkeypox, such as people who are aware that one of their sexual partners in the past 2 weeks has been diagnosed with monkeypox, people who had multiple sexual partners in the past 2 weeks in an area with known monkeypox, people whose jobs may expose them to orthopoxviruses, such as laboratory workers who perform testing for orthopoxviruses, laboratory workers who handle cultures or animals with orthopoxviruses, some designated healthcare or public health workers. How long does monkeypox last? Monkeypox normally takes about 2 to 4 weeks to run its course. If you are exposed to monkeypox, your provider will monitor you until the rash resolves. Is monkeypox fatal? The less severe West African clade is causing the current world outbreak, 2022. No one has died from this outbreak to date. But monkeypox can lead to other problems, complications like pneumonia and infections in your brain, encephalitis or eyes, which can be fatal. How do I take care of myself? If have monkeypox symptoms, there are over-the-counter medications that can help you feel better, including pain relievers and fever reducers, medicines like ibuprofen, Advil registered sign, Motrin registered sign, and acetaminophen Tylenol registered sign, can help you feel better. Oatmeal baths. Soaking in a warm bath with colloidal oatmeal can relieve the dry, itchy feeling that comes with skin rashes. Isolate yourself if you're infected. Avoid contact with others until all your lesions have scabbed. Cover single or local lesions. Use gauze or bandages to limit spread to others and the environment. Take good care. It's important to stay home and rest when you're sick. Wear a mask around others and drink plenty of fluids. Avoid contact with pets, especially rodents. When should I see my healthcare provider? Call your healthcare provider if you feel sick with fever, aches or swollen lymph nodes, have a new rash or sores, have been in close contact with an infected person. When should I go to the ER? Seek medical care if you develop the following symptoms: trouble breathing, new or worsening chest pain, stiff neck, are confused or can't think clearly, difficulty speaking or moving, loss of consciousness, seizures. What is the difference? Monkeypox versus chickenpox. Although they both cause skin rashes, monkeypox and chickenpox are caused by different viruses. Monkeypox is an orthopoxvirus, while chickenpox is a herpes virus. Both viruses can be spread through skin-to-skin or prolonged face-to-face contact, but chickenpox is very contagious and spreads more easily than monkeypox. People with monkeypox are more likely to have swollen lymph nodes than people with chickenpox. The rashes act differently too. While the chickenpox rash can appear in waves, monkeypox sores develop at the same time. Chickenpox symptoms, including the rash, tend to get better within 2 weeks, while it takes 2 to 4 weeks for monkeypox to resolve. Monkeypox versus smallpox. Smallpox and monkeypox are both part of the orthopoxvirus family, so they're caused by similar but distinct viruses. Thanks to effective vaccines, smallpox was eradicated as no longer a circulating disease by 1980. Smallpox was very contagious and spread more easily than monkeypox. Monkeypox symptoms are similar to but milder than smallpox symptoms. A note from Cleveland Clinic: the last 2 years have been incredibly challenging. The COVID-19 pandemic changed so much about the way we lived and worked. Now, just as we are starting to ease back into regular life, we're hearing a lot of media stories about monkeypox as an emerging threat. But monkeypox is a rare disease. It's spread through close contact like kissing and sex, though we're still learning about how monkeypox spreads in humans. The best way to protect yourself is to avoid contact with people who are infected. Wash your hands frequently and wear a face mask in crowded, indoor spaces. Early symptoms of monkeypox are flu-like and include fever, chills and body aches. After a few days, a rash will begin to develop. See your healthcare provider if you develop symptoms. Baton Rouge, La. WAFB, the CDC reports more than 1,900 cases of monkeypox reaching nearly every state. In Louisiana, the Department of Health confirmed 17 cases and health officials expect to see more. The good news is that testing is getting easier. Before this week, samples could only really be sent to our state lab in Baton Rouge, the Office of Public Health Lab. Now they can be sent to a number of normal labs, said Dr. Joseph Cantor with the Louisiana Department of Health. Dr. Vincent Shaw, a doctor with Baton Rouge General, says some symptoms are more noticeable than others. The symptoms that most people will get are going to be a rash or what they call a pox-like rash, which are going to be blisters or little, small pimples. In addition to that, they're going to have some flu-like illness symptoms such as fever, cough, body aches, muscle aches in addition to a swelling of lymph nodes, said Dr. Vincent Shaw, Baton Rouge general physician. There are only 1,000 doses of the vaccine in the state. Health officials are only giving them to folks who are high risk or those who have been exposed. Although doctors are encouraging you to be cautious, they say that this virus is not the next COVID. I think everyone is a little bit on edge because of COVID and the fatigue with COVID, but we just must make it clear that this is not Ebola. This is not expected to become a massive disruptive pandemic. Dr. Joseph Cantor, LDH. Monkeypox is not deadly and usually takes about 2 weeks to heal. If you think you have contracted the virus, medical professionals advise you to contact your doctor and isolate for a few days.
Okay, you guys, you heard it. It's not deadly unless you have underlying, issues. And I just wanted to read off the states, the numbers that have it. Let me take that off. All right, to start with, Alabama has 4, Arizona has 29, Arkansas has 3, California has 356, Colorado has 47, Connecticut has 19, Delaware has 3, District of Columbia has 110, Florida has 247, Georgia has 211, Hawaii has 8, and Idaho has 2. Illinois has 238, Indiana has 31, Iowa has 6, Kansas has 2, Kentucky has 4, Louisiana has 21, Maryland has 71, Massachusetts has 79, Michigan has 27, Minnesota has 19, Missouri has 5, Nebraska has 5, Nevada has 8, New Hampshire has 3, New Jersey has 41, New Mexico has 7, New York has 900. 900, you guys. North Carolina has 13, North Dakota has 1, Ohio has 4. Oklahoma has 4, Oregon has 36, Pennsylvania has 55, Puerto Rico has 10, Rhode Island has 9, South Carolina has 7, South Dakota has 1, Tennessee has 19, Texas has 107, Utah has 13, Virginia has 40. Again, Virginia has 40, Washington has 60, West Virginia has 1, and Wisconsin has 6. That's the cases that are in the United States, okay? Now, this is what it looks like. The gray out does not have it, so you got Alaska doesn't have it. And all the other states that I mentioned has it. And this is how many cases in 2022. Total confirmed monkeypox, orthopox virus cases 2,891. 1 Florida case is listed here, but included in the United Kingdom case counts because the individual was tested while in the UK. Hello, boss man. How are you? Marty and Jamie, how are you? D Love, thank you for coming in. And let's see who else been in here. Sheila E, thank you for coming in. Appreciate it. So, everybody. Thank you for coming in. I just wanted to mention what's going on. Yeah, we had Rona and now we have the monkeypox. So I did it. The other video that I did, this is take 2 because part 1, I forgot to put myself on the panel so you guys could not hear me. But that's okay. So this is part 2, you guys. Enjoy. Have a great evening. Oh, by the way, before I leave, please hit the like. And 2, at 8 o'clock, I will be doing a night, like my good night sleep video live with the music and a different video now. It's going to be a little different. I'm going to try to do different ones as much as possible. Sometimes they might be repeats, but be different days. So come on in, take off your shoes, relax, and get you some rest. All right, you guys, have a great day. Thank you for coming in. Bye.